Have you noticed that someone close to you has been changing in small but worrying ways over the past year? Although a lot of people think that old age death happens quickly, the body often sends quiet signs months, or even a year, before it reaches its end stage. The problem is that these signs are often missed because they don't seem important at first. Families don't know the clues were there the whole time until they look back. However, it's too late to get ready or enjoy the time we still have together. We'll talk about 5 important signs that an older person is about to die in this video. These signs usually show up about a year before the person dies. Some may be things you've noticed but thought were just part of getting older, while others may seem small but are actually signs of the body's slow decline. If you notice these signs early, you can give your loved one better care, make memories that matter, and most importantly, make sure that their last days are as easy, peaceful, and respectful as possible. We will teach you how to spot these signs early on. If this helps you, please like the video and subscribe for more. Let's start now. Read all the way to the end because these 5 signs can help you get ready for what's coming up in both emotional and useful ways. You will not be taken off guard if you know what is going on. You'll be able to spend more time with the people that mean most. Let's start. Unintentional weight loss is one of the first and most obvious signs that someone may be getting close to the end of their life. It might not seem like a big deal at first if your belt needs to be tightened, your clothes look less tight, or your hunger that used to be strong slowly fades. A lot of families don't think much of this because they think it's just part of getting older. But losing weight without trying is usually a bad sign. It usually means that the body isn't absorbing nutrients as well as it used to, that muscle mass is going down, and that important processes are slowing down. Some muscle loss is a normal part of getting older, but when it happens too quickly, it can be a sign of a bigger problem. The body may be having trouble breaking down food, or may not be able to handle protein properly, which can cause muscle loss. Not only does this make it harder to move, but it also makes the person more likely to fall and makes their immune system weaker, making them more likely to get illnesses. Hunger changes can also cause people to lose weight in their last year of life. People over 65 often don't feel as hungry as they used to. They lose their ability to taste things, food stops looking good, and they might start skipping meals or eating a lot less. It's not just a matter of taste, this is a biological change. The body stops telling the brain to look for food as often when it feels that it is about to shut down. This leads to less energy, less strength, and a slow decline in general health. Medical problems that are already there also play a big role. People with long-term illnesses like cancer, heart failure, and kidney disease often lose weight. These illnesses can start to get worse long before they show other signs. People who are depressed or losing their minds can also cut back on their food intake, which can make the body lack the fuel it needs to work properly. Some families try to stop this by telling their loved ones to eat more, giving them their best foods, or adding protein drinks to their diet. But if you keep losing weight despite these efforts, it's important to know that the problem isn't just with the diet. Your body is getting ready for a bigger change. At this point, making them eat big meals might not help. Instead, putting comfort, easy-to-eat foods, and staying hydrated at the top of your list can help you keep your quality of life. If you notice that an elderly loved one is losing a lot of weight, especially if they are eating less, feeling weaker, or having trouble staying busy, this is a sign that you should not ignore. Looks aren't the only thing at stake. This is a word from the body. Being aware of it now can help you face the future with clarity, kindness, and the power to make the most of every moment you have left. One of the most noticeable changes in the year before death is a constant, crushing tiredness that doesn't go away with rest. This isn't just being a little tired. It's a deep, tiredness that makes even the smallest jobs seem impossible. It becomes hard to get out of bed and hard to walk across the room. Things that used to be easy, like cooking, getting dressed, or even having a chat, become too tiring to handle. This isn't just a normal part of getting older, it means your body is saving its energy. As organs start to work less efficiently, the body starts to focus on only the most important tasks. It gets harder for the heart to pump blood, muscles don't get as much oxygen as they used to, and circulation gets worse. This is why a lot of older people in their last few months feel weak, unsteady, and unable to keep up the level of exercise they used to enjoy. Metabolism slowing down is another important reason. The body normally makes and uses energy well, but as it gets ready for the last part, it changes how it uses that energy. Now, instead of encouraging movement and exercise, the body moves toward keeping itself safe. This is why people who are getting close to the end of their lives may start sleeping more, needing to nap more often during the day, and find it harder to stay awake for long amounts of time. Some people may even have sudden drops in energy, going from feeling fine one minute to being completely drained the next. The mental effects of being tired may be one of the hardest parts of this process. Many older people who used to value their independence feel angry or even ashamed when they learn they can't do the things they used to. They might stop talking to people, avoid social situations, or give up hobbies. It's not that they don't care, they just don't have the energy. In this way, they may become so alone that they give up all hope, which speeds up their fall. It can be very sad for family members to see a loved one go from being busy and involved to being tired and distant. I know it's tempting to think they just need to be encouraged or that they should work through their tiredness, but that won't help. Realizing their boundaries, letting them rest when they need it, and making sure their last days are as comfortable as possible are the most important things. When someone you care about is constantly tired and doesn't feel better after resting, it means that their body is going through a big change. Now is the time to treasure talks, make time for peace, and support them without expecting anything in return. Because what matters most is how loved and supported they feel in their last chapter, not how much they get done. As a person gets closer to the end of their life, one of the most noticeable changes is often in how they think, talk, and connect with others. You may notice that someone who used to be mentally active and sharp starts to forget things more often, has trouble following talks, or seems lost even in places they are used to being in. They might say the same things over and over, forget names, or lose track of time, even if they didn't have any major memory problems before. These changes in thinking can happen slowly, sometimes months or even a year before death. This downturn isn't just a case of forgetting things now and then. The brain needs a steady flow of oxygen and nutrients to work right, just like every other organ. As circulation gets worse and oxygen supply drops, brain function starts to get worse. It's possible for the person to get lost more easily, have trouble making choices, or forget who and where they've known for years. There are times when they may have short periods of clarity followed by uncertainty, as if their mind is going in and out. Withdrawal from emotions is another usual sign. As death draws near, a lot of people lose interest in mingling. You might notice that they talk or interact with you less, or that they sit still for long amounts of time. They still care about their friends and family, but their brain isn't processing feelings and social interactions the same way it used to. It can be tiring to have conversations and be in places with a lot of noise. As a result, many adults withdraw from society and stop interacting with others. There may also be changes in how you act and how you feel. Some people become more irritable, anxious, or easily frustrated, while others seem calm, distant, or uninterested in things that used to mean to them. This isn't just a change in behavior. It's often the brain getting used to the body's slow decline. It gets harder to explain how someone feels as their cognitive function decreases, and they may stop responding to events in the same way they did before. This time can be very painful for family members. Watching a loved one lose touch with reality or mentally pull away can be like losing them before they've even died. It is important to remember, though, that this is not something they choose or can control. You shouldn't try to bring them back into the talk. Instead, you should meet them where they are. Talk to them gently and reassure them. Also, remember that they can feel your presence even if they don't answer right away. If someone you care about is forgetting things, getting confused, or acting emotionally detached, don't ignore these changes. They are often early signs that the mind and body are getting ready for the final change. Now is the time to be patient. Enjoy the quiet times you have together and work on making the space feel calm and comfortable. Love and relief can still be deeply felt even when words fail. A weak immune system is one of the most obvious signs that the body is starting to shut down. You might notice that someone who used to rarely get sick now gets every cold, flu, or other bug. It takes a lot longer to get better from illnesses that used to go away quickly. Even small wounds like cuts and bruises heal much more slowly now. These changes are not happening by chance. They mean the body is losing its power to heal and protect itself like it used to. At this point, getting infections again is one of the biggest worries. As the immune system gets weaker, more and more people get infections like asthma, urinary tract infections, UTIs, skin infections, and even oral infections. Families often think of these as one-time health problems, but when infections happen a lot or take a long time to go away, it's often a sign that the body is having a hard time fighting back. It is possible for medicines that worked well in the past to start to work less well over time. For infections that were once minor, a person may need stronger medicines, longer healing times, or more than one round of treatment. If you get cuts, sores, or bruises that don't heal right away, or that keep opening up, it could mean that your circulation isn't good. When blood flow is reduced, oxygen and other important nutrients have a harder time getting to the skin and organs, which makes the healing process much slower. People who can't move around as easily may be most concerned about this because they are more likely to get pressure sores, which can become dangerous infections if they aren't treated properly. More scary is the fact that infections in the last year of life don't always show up the way people think they will. An older person may not have a high fever or other obvious signs. Instead, they may just seem tired, confused, or less hungry. Actually, a quick drop in mental alertness is often one of the first signs of an infection, showing up before any physical symptoms do. Because of this, noticing these small changes early on can make a big difference in how well they are cared for and comforted as they die. Families can find it frustrating and upsetting to see a loved one get infections over and over again. People often want to get aggressive medical care, thinking that more antibiotics or another stay in the hospital will fix the problem. But at some point, the goal shifts from healing to making people feel better. Making sure they stay hydrated, keeping their skin clean and moisturized, and lowering their stress levels can sometimes do more for their general health than more medical treatments that may only make their pain last longer without making their quality of life better. A change in breathing rhythms and circulation is one of the best ways to tell that the body is moving into its last stage. You might notice that the person you care about is breathing less deeply or more slowly than usual. Sometimes they might stop between breaths, or their breathing might become irregular, going back and forth between quickly and slowly. Some people develop a rhythm of breathing called Cheney-Stokes respiration, in which they have times of deep, fast breathing followed by apnea, which are times when they stop breathing. These changes may start out slowly but get stronger over time. Weakened blood is another sign that the body is slowing down. If you touch their hands, feet, nose, or ears, you might notice that they feel very cold. Around their toes and fingers, their skin may look pale, bluish, or speckled. This happens because the body starts sending more blood to the important organs and less to the rest of the body. This is a clear sign that the heart isn't beating as well as it used to. You may also feel short of breath more often, even when you're not doing much. It's possible for them to get out of breath just by standing up, talking, or changing positions. They might breathe through their mouths more often or stop talking in the middle of a speech because they are short of breath. If they used to be able to move around easily, but now find it hard to walk across the room, it could mean that their lung function is getting worse. Having too much blood in the lungs can sometimes make it even harder to breathe. This can make you cough all the time, make a bubbling sound when you breathe, or feel like your chest is tight. A lot of people think these symptoms are caused by stuffy noses from colds, but in older people who are getting close to death, they often mean their lungs are getting weaker. Because of this, lying flat can be painful for them, so they like to sleep on pillows or in a chair to make it easier to breathe. These changes can be scary for family members. It's normal to want to help, like telling them to take deeper breaths or worrying that something important is going to happen soon. Most of the time, though, these changes are just the body's normal way of slowing down. Even though these changes might not always be able to be undone, there are ways to make sure you are more comfortable. Using a fan, keeping the room cool, or giving small sips of water can help ease the pain. Some people may feel better with medicine or oxygen therapy, but at this point, the focus usually moves from fixing the problem to making sure they are as comfortable as possible. Any changes in breathing, cold limbs, or a blue tint to the skin are signs that the body is trying to save energy and blood flow is slowing down. Now is the time to be there for them, reassure them, and make sure they feel safe and at ease in a calm space. In the last few weeks or months, the most important thing you can do for them is not medical help, but support, respect, and the knowledge that they are not alone. As this video comes to a close, take a moment to think about the main signs we've talked about: noticeable weight loss, extreme fatigue, cognitive decline, frequent infections, and big changes in breathing and circulation. Most of the time, these 5 signs show up in the year before an older person dies. When they start to show up, they're important signs that the body is getting ready for the big change. They might not all show up at the same time, or be clear at first glance. It's very hard for many families to accept these changes. It's natural to want to fight them and push someone you care about to eat more, move more, or keep going even when they're tired. But sometimes the kindest thing we can do is pay attention to what their body is telling us. We don't have to try to change what will happen. Instead, we can make sure that their last moments are as peaceful, comfortable, and important as possible. It's not about being afraid of death to notice these signs. It's about being ready for it. You can give better care, make smarter choices ahead of time, and make sure that your loved one's last months are full of love and respect if you know what is going on. Now is the time to treasure moments, tell stories, and make sure they know you care and support them. There are other people going through the same things you are. Take a deep breath and remember that you are not alone. If you know what to expect, you can find strength, patience, and peace. This is a road that many families have taken before you. Thanks for seeing it. Please get in touch with us. Write a comment below about what you learned today and how you're going to use it. Your ideas and experiences are important, and reading your opinions makes us want to do better and give us hope. Enjoy this video? Please like, subscribe, and share it if it looked helpful to you. Thanks to your help, we can keep making useful content for you to learn from and be inspired by. Thanks for being here, and we hope to see you in the next show.